Pediatric emergency nursing is a demanding and rewarding field. It requires a unique blend of knowledge, skill, and compassion. Pediatric emergency nurses are on the front lines of care for children experiencing a wide range of medical emergencies. From minor injuries to life-threatening conditions, these nurses are trained to act quickly and decisively. Two crucial skills in any pediatric emergency nurse's arsenal are Pediatric Basic Life Support, or BLS, and Pediatric Advanced Life Support, or PALS. These protocols provide a standardized framework for responding to pediatric emergencies. They ensure that every member of the healthcare team is working together seamlessly to provide the best possible care for critically ill children. BLS focuses on the foundational skills needed to manage respiratory and cardiac arrest in infants and children. This includes techniques like chest compressions, rescue breaths, and early defibrillation. PALS builds on this foundation, incorporating advanced airway management, vascular access, and medication administration. This essay will delve into the intricacies of BLS and PALS. It will highlight the vital role pediatric emergency nurses play in utilizing these life-saving protocols. It will also explore the multifaceted responsibilities these nurses shoulder in caring for our most vulnerable patients. Pediatric Basic Life Support, or BLS, is the cornerstone of emergency care for infants and children. It encompasses a series of interventions designed to support breathing and circulation when a child's heart or breathing has stopped. The core components of BLS are easily remembered by the acronym CAB compressions, airway, and breathing. Chest compressions are the foundation of BLS. They involve rhythmic compressions of the chest wall, which manually pumps blood to the vital organs, including the brain. Maintaining a consistent rhythm and depth during compressions is crucial. This ensures adequate blood flow and oxygen delivery. Airway management is the next critical component of BLS. It involves ensuring the child's airway is open and clear of obstructions. Techniques like the head tilt-chin lift maneuver can help open the airway, allowing for effective rescue breaths if needed. Rescue breaths, the B in CAB, involve delivering breaths of air into the child's lungs. This provides essential oxygen when the child is unable to breathe effectively on their own. The rescuer uses a barrier device, like a pocket mask, to deliver breaths safely and hygienically. Together, these core components of BLS provide a critical bridge of life support. This support helps sustain a child until more advanced medical help arrives. Every second counts in a pediatric emergency. Prompt and effective BLS can mean the difference between life and death. The BLS protocol follows a systematic approach, ensuring no crucial step is missed. The first step is always scene safety. Before approaching a potentially critically ill child, the rescuer must ensure the environment is safe for themselves and the child. Once safety is established, the next step is to assess the child's responsiveness. This involves gently tapping the child and speaking loudly to see if they respond. If the child is unresponsive, the rescuer immediately activates the emergency response system, calling for help from trained medical professionals. With the emergency response system activated, the rescuer then assesses the child's breathing and pulse. This assessment should take no longer than 10 seconds. If the child is not breathing or has no pulse, or if there is any doubt, the rescuer immediately begins chest compressions. Chest compressions for infants and children differ slightly from those for adults. For infants, the rescuer uses 2 fingers placed just below the nipple line. For children, the rescuer uses 1 or 2 hands, depending on the child's size, pressing on the lower half of the breastbone. Once chest compressions are initiated, the rescuer then addresses the airway and breathing. If the rescuer is alone, they should provide 2 minutes of CPR before pausing to activate the emergency response system and retrieve an AED if available. The goal is to maintain a continuous cycle of chest compressions and rescue breaths until advanced medical help arrives. Pediatric emergency nurses are often the first responders in a pediatric crisis. They are trained to remain calm and act swiftly, putting their BLS skills into action to stabilize the child. Their ability to quickly assess the situation, prioritize interventions, and deliver high-quality compressions and rescue breaths is paramount. However, their role extends far beyond being adept at the technical skills of BLS. They are also skilled coordinators. They direct other healthcare providers, delegate tasks effectively, and ensure seamless communication within the resuscitation team. Pediatric emergency nurses understand the emotional turmoil families experience during a medical crisis involving their child. Providing emotional support and clear, compassionate communication to families is a crucial aspect of their role. They act as advocates for the child and family, ensuring their voices are heard and their needs are met. Furthermore, these nurses play a vital role in education. They educate families on injury prevention, basic first aid, and the importance of learning CPR. This empowers families to feel more prepared and confident in responding to emergencies. While basic life support, or BLS, forms the foundation of pediatric resuscitation, pediatric advanced life support, known as PALS, takes it a step further. PALS encompasses a broader range of interventions and skills designed to manage more complex pediatric emergencies. Like BLS, PALS utilizes a systematic approach, emphasizing early recognition and management of respiratory and circulatory compromise. PALS goes beyond the core BLS skills. It incorporates advanced airway management techniques, such as bag mask ventilation and the placement of advanced airway devices like endotracheal tubes. These techniques help secure the airway and ensure adequate oxygen delivery, especially in critically ill children. Vascular access is another crucial component of PALS. Establishing reliable intravenous or intraosseous access allows for the administration of life-saving medications. Medications used in PALS can help stabilize heart rhythms, increase blood pressure, and treat specific causes of cardiac arrest. PALS also emphasizes post-resuscitation care. Once a child's heart and breathing are restored, the focus shifts to optimizing their condition and preventing further complications. This includes close monitoring, medication management, and addressing any underlying medical conditions. The PALS protocol, like BLS, follows a structured approach to ensure a comprehensive and efficient response. The initial steps mirror those of BLS, beginning with scene safety and assessment of the child's responsiveness, breathing, and circulation. If a child is unresponsive and not breathing or has no pulse, the PALS provider immediately activates the emergency response system and initiates CPR. However, PALS incorporates advanced airway management techniques early in the resuscitation process. PALS providers are trained to recognize and manage different types of airway obstructions and respiratory distress. They use specialized equipment such as laryngoscopes and endotracheal tubes to secure the airway and provide assisted ventilation if needed. Once the airway is secured, the focus shifts to establishing vascular access. This allows for the administration of medications that can help stabilize the child's condition. The PALS protocol includes specific guidelines for medication dosages based on the child's weight and the underlying medical condition. Pediatric emergency nurses who are PALS certified play a critical role in managing complex pediatric emergencies. Their advanced knowledge and skills allow them to provide a higher level of care. They are skilled critical thinkers, able to quickly process information, prioritize interventions, and adapt their approach as the situation evolves. As integral members of the resuscitation team, they collaborate effectively with physicians, respiratory therapists, and other healthcare professionals. They communicate clearly, advocate for the child's needs, and ensure that all interventions are performed safely and effectively. Pediatric emergency nurses also play a vital role in educating families about PALS procedures and the child's condition. They provide emotional support, answer questions honestly and compassionately, and act as liaisons between the family and the medical team. Finally, meticulous documentation is a crucial responsibility of pediatric emergency nurses. They accurately document the child's condition, the interventions performed, and the child's response to treatment. This documentation is essential for ensuring continuity of care and providing valuable data for quality improvement initiatives. Pediatric emergency nurses are so much more than just lifesavers during a code. They are a constant source of strength and support for children and families facing frightening and uncertain situations. Their compassion, empathy, and unwavering dedication make a world of difference in the lives of those they touch. They are masters of distraction, using their creativity and gentle touch to ease a child's anxieties during painful procedures. They are skilled communicators, explaining complex medical information in a way that children and families can understand. Their impact extends far beyond the hospital walls. They are advocates for children's health and safety, working tirelessly to prevent injuries and promote well-being within their communities. They educate families, train future healthcare providers, and strive to create a world where every child has access to high-quality emergency care. In the often chaotic and unpredictable world of pediatric emergency care, one thing remains constant: the unwavering dedication and compassion of pediatric emergency nurses. They are the heart and soul of pediatric emergency departments, and their contributions are invaluable. Their unwavering commitment to providing the best possible care for children makes a lasting difference in the lives of countless children